Hi everyone, this is the second part of the blood transfusion safety video, and in this we'll be seeing the definition of transfusion safety, the best practices to be followed, and the leadership checklist to facilitate transfusion safety. Hi, I'm Sharon. I'm working as an associate professor at M College of Nursing. The following are the objectives that we'll be addressing in this video. Nearly 120 million units of blood are donated every year. Hence, we see that there is a massive need to maintain safe and effective procedures around the collection, storage, and use of donated blood. Collectively, this is called hemovigilance. These procedures cover the entire blood transfusion chain and are used to standardize the use of blood in healthcare. Now, let's look at the definition of transfusion safety. It is the practice of maintaining safe procedures for the collection, storage, and the use of donated blood. Transfusion safety is important because transfusing incompatible blood can cause serious life-threatening reactions. However, the risk of infection can be reduced by proper screening. Now, let's look at the best practices that facilitate transfusion safety. The first one is assessment and decision making. And the practices involved are: consider alternatives to a blood transfusion, such as patient blood management strategies, and evaluate the risks and benefits of a blood transfusion. Involve the patient in the decision-making process, if possible, and explain the risks, benefits, and alternatives to a blood transfusion. The next best practice is appropriate ordering. Here, use a standard order set and clearly communicate key information for the transfusion, including but not limited to patient identification, type of units, and special requirements. The next is to ensure clear communication between the ordering provider and the blood bank personnel. The next best practice is order fulfillment. Here, we have to conduct appropriate testing, including but not limited to the blood type and screening, ABO comparability for plasma, and antibody identification. The next is to appropriately label blood components with all the relevant information, and to ensure the blood component is appropriately stored and transported by appropriate personnel. The next best practice is verification and administration. Here, ensure 2 licensed professionals personally double-check all the relevant information, including but not limited to the patient identity, patients and donors' blood ABO group, and RS factor, as well as cross-matching data, and evaluate relevant lab and clinical data and document the baseline vitals, and ensure that the patient has filled out the consent form. In continuation, monitor patient for signs of reaction and remain with the patient for at least 15 minutes after administration. Alert the provider if there are signs of reaction and treat appropriately. And complete the post-transfusion documentation, including any complications. Now, let's look at the leadership checklist that has several activities to facilitate blood transfusion safety. We'll be looking at each of it in detail. The first one is to strengthen the relationship between the blood bank personnel and providers. If possible, create a permanent position for a physician trained in transfusion medicine for the organization. Equip blood bank personnel with tools to help ordering providers effectively make decisions around the true indications for blood transfusions. Standardize the approach to transfusion decision making and incorporate this into training as well as protocols. Identify opportunities for collaboration between blood bank personnel and organ providers, example, through interdisciplinary education, performance improved initiatives, design of patient education material, etc. And to also identify frequent areas of miscommunication, example, unit terminology and the difference between cc, kilo, and unit, and incorporate standards to mitigate in ongoing education, order sets, readily accessible protocols, electronic health record, etc. The next is to ensure the transfusions are effectively used. This can be achieved by clearly defining all criteria for transfusion of all blood components, including appropriate patient assessment, both clinical as well as lab. Require timely documentation of hemoglobin levels, vital signs, and patient condition before and after each blood transfusion. Expect that transfusion decisions are made based on signs and symptoms, in addition to invasive or non-invasive hemoglobin measures and other measures of tissue oxygenation. Thoroughly implement and standardize a patient blood management program across the system to avoid unnecessary transfusions, and ensure all order sets are designed to prompt all clinical considerations beyond just the number. Ensure these order sets also include information about signs and symptoms. Incorporate hard stops for information missing in the electronic health record upon ordering blood for non-actively bleeding patients. The next is to use debriefs and educational opportunities meaningfully for behavior change. The first is to reinforce the importance of documentation post-transfusion, including the reason for the transfusion, the outcome, and whether or not the transfusion alleviated the signs and symptoms for which it was ordered. The next is to standardize expectations for data review, that is a timeline, what data is reviewed, what data is missing, and prioritize timely feedback to all involved in transfusion safety. And further ensure data is not exclusively reported to only one transfusion safety committee, but is meaningfully shared and used to change gaps in protocols, policies, etc. And share information about whether a transfusion could have been prevented and other strategies could have been employed. And also share information about wasted blood components and understand why excessive blood products were ordered. The next is to increase awareness of transfusion risks, benefits, and alternatives among all within the organization. It is necessary to provide feedback to partner academic institutions about transfusion safety competencies to include in the graduate curriculum, and to consistently reinforce the appropriate considerations for transfusion decision making, and also to integrate the transfusion guidelines into order sets, the EHR, protocols, ongoing education, and ensure these guidelines include both data-driven indications for the transfusion such as HP level and the individual specific criteria that should be considered for a transfusion. That is, even if the hemoglobin level is low, consider the patient's signs and symptoms. The next is to make sure patients know their role in transfusion safety and are aware of the options available to them. So this can be done by standardizing discharge education for chronically ill patients that includes if and why they are potentially at risk for future transfusion and what they can do to avoid a transfusion in the future. And involve patient and family advisory councils in understanding what the organization is or is not telling patients and family members about alternatives, and ask whether patient needs are being met with the information given. Involve PFACs in understanding the patient experience post-hospital transfusion to understand how their conditions were maintained or improved. The last step in the leadership checklist is to implement and sustain performance improvement initiatives. This can be done by ensuring transfusion safety information is mutually reinforcing and consistent in policies, ongoing education, labels, patient education, blood bank personnel tools for communication, EHR order sets, etc. Listen to those on the front line about their experience in blood transfusion processes and involve them in continuous improvement efforts, and ensure there are enough staff to effectively manage care when a transfusion is indicated at the bedside, and establish a culture where other bedside clinicians will step into care for the nurses, other patients when one of the nurse's patients is being transfused. Debrief consistently and make people feel safe in sharing their perspectives by offering praise for the information and by making it very easy for them to provide feedback. And hold staff accountable for providing the standard of care and reward success. Further, ensure that leaders have a simple process to oversee improvement work while also considering how it aligns with other initiatives across the organization. And ensure the Transfusion Safety Committee is aligned with and communicating with other relevant committees. The following are the references. Do look out for part 3 of this video.